With you, the minority leader for the Mississippi House of Representatives, Representative Robert Johnson. How you doing today, my friend?
I'm doing good. It's good to be here. How are you?
Good to see you.
Yeah.
And it's no less contentious a time as it was the last time you and I sat here in this room and talked.
Right.
If anything, it's a little worse in spaces.
It is worse, and nobody thought it could get worse. I mean, and we're talking about the pandemic, but we got the opportunity to develop vaccines, and people started getting their shots, and we thought we were on our way to recovery and getting it done. Then a new variant comes out, and then as simultaneous with that, you still got people saying, "I don't want a vaccine. We don't need to take it. I don't want to wear a mask." Those are the things we have to deal with. But I'm encouraged by the fact that across the board, most people who are in leadership and who are responsible are saying, "Get your shot. Let's get it done." Don't care that there are anti-vaxxers out there who are politically strong and loud. So get your shot, and I think that's important.
Well, and we're starting to see some movement to more of a bipartisan approach to that, even over in the legislature. You and I were talking before we went off the air, and I mentioned it earlier that it broke last night that House Speaker Philip Gunn and the Lieutenant Governor Delbert Hosemann have come together and said that they are in favor of a special session to deal with COVID-19 and what's going on right now. Did that surprise you?
Well, I wasn't really surprised. I was surprised that they publicly came out. When I did a press release on Friday urging the governor to issue a statewide mandate on masks and urging the governor to call a special session to put the legislature to work, I did that, and then right after that I talked to the speaker. He and I were just talking about some other things and talking about that, and I said to him, I said, "Look, we're having all these hearings. We're having hearings on medical marijuana. We passed medical marijuana. What are we having hearings for? Let's just ratify what people have already passed and get it done." We are about to have hearings, of which I'll be a part of, on the income tax reform and what we're going to do about that. Something that, we need to work on, but it's not a urgent thing. But what it speaks to is that the legislature is in business. We are available. People can come to hearings. We can conduct business. The business we ought to be conducting is finding a way to offer support to our essential workers, our healthcare institutions, and our schools, places where they need our help and support, and there are things we can do. And so he agreed with me. And so I was surprised by the fact that it came out in the paper, but he and I were on the same page on that.
Well, we had it also yesterday that came out that DeSoto County has asked the state to come set up a field hospital,
right,
because they cannot handle the number of sick people that they have right now. And that kind of speaks to what we're talking about. You issued that press release on Friday, but there has been a lot of conversation lately regarding what the state can do with the CARES Act funds that are in the bank account to help alleviate this. What can be done?
Just about anything. There was a letter from Singing River Hospital that came out over the weekend saying that, look, let's take some of that $1.8 billion and give it to us so we can hire more nurses, or we can pay the ones we have more money so they won't be encouraged to leave and go places where they can make more money. We're losing. So people, the governor said, well, people are quitting because people are making them get vaccinated or it's too much stress. Part of the reason people are leaving because they are overworked, they are burnt out, because a lot of their colleagues have left. They're not sitting at home. They're working in Louisiana, California, places where people are paying them. And so, and I don't get, this is not anecdotal information that I just come up with out of the air. This is what hospital administrators, healthcare professionals are telling me. If we would put more money into our system, we could keep more people and hire more people. We could bring more people in. So let's get back to DeSoto County Hospital and needing beds set up. And people say, well, it's more than just about money. Well, if you have enough money, there are places you can recruit people and hire people to come in. It is not an overnight process, but it's something that we can get done pretty quickly. But we have the resources to do it. Now, the $1.8 billion, one of the things that came out in the federal legislation was You can use it to enhance pay of essential workers. That's not just healthcare workers. You can do it for grocery store workers and people who are working every day to keep our utilities going. All those kind of things that you need to do, that money is for that. We have a lot of schools kids who have not been vaccinated, because a lot of people's kids are not vaccinated. They're going to school. People are getting infected. It's becoming a problem. Some schools are going to have to go virtual. Some of them will have to. Some of that money can be used to help support and do what you can do. Maybe some emergency method or technology you can use to do broadband. All of that can be done. But that money is for COVID-19 relief in whatever manner you need to reinforce your infrastructure and get that done.
And talking about that, Smith County School District announced late yesterday they were going virtual for 2 weeks.
Understandably.
And we've heard a lot of those announcements over the last, 3 weeks, I would say, and probably not done with those announcements.
No, I mean, I'm just thinking creatively here. People saying people are waiting in line 8 and 9 hours for testing. Well, testing is just taking a swab, taking it into a lab. You can employ people. You don't need a nurse to take a swab. But you could just hire people, train them to take tests, and get more people on the ground getting that done. But vaccinations, children who are over 12. If you could employ enough people in the personnel and these community health centers all over the state, they would set up sites at schools for people when they come in. Hey, you got a permission letter from your parent. You want to get? They said you can take a shot. Let them take a shot. And make it convenient for people to get. Somebody told me the other day that there are a lot of people who may not have gotten the vaccination, not because they're against it, but they didn't want to stand in line for an hour. So there are some employers who set it up at their job site, and people they almost had a 90 to 95% participation. It's just make it easy, and money and support and resources can help you do that.
It greases all the wheels.
Yes, sir. It makes it happen.
One thing, we mentioned it at the beginning, and I want to make sure, because I see a couple of people on the C Spire text line talking about, well, where is the money going to come from? We have the money. It's in the bank.
$1.8 billion that the federal in CARES Act relief funds that has been here since at least the end of June. It's been here. And we have until 2024 to use it. And some people, we'll take our time. We don't have time. People are dying. Our healthcare infrastructure is at a critical stage that they need help and support. But that's where the money comes from. But on top of that, we have a surplus in our own state budget. But we don't have to touch that. We have money that the federal government gave us to do exactly and to address this exact same problem.
Well, one issue that a lot of people have with some of these ideas is the concept, you talked about increasing pay for essential workers and whatnot. These are one-time funds. When they are spent, what happens to that pay increase? Where does that come from?
Well, hopefully this is a one-time incident. I mean, right now, my concern is not about where does the money come from after this. My concern right now is keeping people alive and keeping our hospitals open and keeping people employed. That's what my interest is right now. And we can plan and work on where we go from there, but where is it going to come from later? It's going to come from us managing and working with our healthcare. One of the ways we can do it with essential workers, especially healthcare workers, we could expand Medicaid. That's $9 billion sitting on the table that we can employ and put into place, and because we need it. We are a state that has just terrible health outcomes. We need more doctors, more nurses, more healthcare people, and we need our hospitals, even in small rural areas, to stay open.
Well, and that's true, but there are a lot of people that don't think expanding Medicaid is the way to go about that.
Well, there are a lot of people that don't believe you should get vaccinated either, but you should. There are a lot of people that don't believe you should wear masks, but you should. I'm saying that not because Robert Johnson says it. I'm saying it because every person who is trained and spent 8 years in medical school and been practicing medicine for 20 and 30 years say that's what you need. So, this idea that there are people out there that don't believe it, when a person that runs a multi-million-dollar hospital operation that keeps people alive says that we need to expand Medicaid, we need that money to keep our hospitals open, that's the expert I want to listen to. I don't want to listen to Joe Blow down the street that says, well, I don't agree with it, I don't know what we want to do. Well, I don't want to listen to some other elected official who is running some political diatribe because it serves a purpose but doesn't get the job done for the people of the state of Mississippi. This is not a political issue with me. This is a person that represents an area like Natchez, Mississippi, and Fayette, Mississippi, where they have hospitals that people need in those rural areas where they don't have to drive 60 and 90 miles to a hospital, but you need them, but they can't stay open unless we do something.
Well, and I think the concern is, yes, we have a lot of federal matching funds and a lot of federal money that would come in, but what happens when that's gone?
It's not gone. When is it ever gone? People keep saying that we've been a federal matching fund state since I've been alive, and we've never turned money down, and the money has never stopped coming. So what is this forecast that it's going to stop now? There's no reason for people to say that. We not only have we always gotten federal matching funds, but we have gotten more as the years have gone on. So if the trend is what it has always been, Mississippi is not going to get less. We've gone from 50 to 60 to 70%. Now we're a 90% federal fund matching state.